Hi, I'm Dr. Siobhan Dolan of the March of Dimes, and I'd like to talk to you about fertility treatment and getting pregnant with just one baby. The most common complication that fertility treatment can cause is getting pregnant with multiples. Multiples means you're pregnant with twins, triplets, or more. Being pregnant with multiples can cause problems for your baby, like premature birth. This is birth before 37 weeks of pregnancy. Premature babies are more likely to have health problems at birth and later in life than babies born full term. Low birth weight. This is when your baby weighs less than 5 pounds, 8 ounces. Birth defects. These are health conditions that are present at birth. They change the shape or function of one or more parts of the body. The March of Dimes believes that if you're getting fertility treatment, it's important to try to get pregnant with just one baby. Talk to your healthcare provider about ways to make this happen. For example, if you're having a fertility treatment called controlled ovarian hyperstimulation, or COH, you get medicine to help your body ovulate. When you ovulate, you release an egg. If you're having COH, your provider can adjust your treatment if she thinks you're likely to release more than one egg. If you're having fertility treatment called in vitro fertilization, or IVF, an egg and sperm are combined in a lab to create an embryo that your provider puts into your uterus. The March of Dimes recommends that most women getting IVF have just one embryo placed in the uterus. This is called single embryo transfer, or SET. Ask your provider if single embryo transfer is right for you. Making changes in your life may help improve your chances of getting pregnant without fertility treatment and help reduce your risk of pregnancy complications. Here's what you can do. Don't smoke. Get to a healthy weight before pregnancy. Talk to your provider about any medicine you take. Remember, fertility treatment can cause complications, like getting pregnant with multiples and premature birth. Talk to your provider about ways to help you get pregnant with just one baby. Make changes in your life to get healthy and increase your chances of getting pregnant without fertility treatment. For more information, visit marchofdimes.org.